Dr. BASHYAL.
Good afternoon, everyone. Thank you, AIOS, for giving me this opportunity to speak on this topic. Today, I'll be talking about role of azathioprine in management of refractory VKC in steroid-induced glaucoma. I have no financial interest. The role of steroid comes in very severe grades in VKC, where in grade 3 or grade 4, the patients are given pulse steroid eye drops along with cyclosporine eye drops. But as we all know, steroids are having so much of complication like cataract, glaucoma, delayed wound healing, and increased risk of infection. And in this series, they have reported that rise of intraocular pressures were present in 32.9% of 249 patients, and steroid-induced glaucoma was observed in 15 patients, which was 6.1%. So coming to steroid-sparing agents, so apart from steroids, like other agents like alkylating agents, antimetabolites, T-cell inhibitors, or biological agents can be used. So I'll be talking about this azathioprine, which is an antimetabolite, and it is purine synthesis inhibitor. It incorporates into replicating DNA and halts the division of the cells. So and also it doesn't penetrate the blood-brain barrier, and it is metabolized in liver and excreted via kidneys. The side effects are nausea, fever, arthralgia. They are quite common, and bone marrow suppression, hepatotoxicity, renal toxicity, infection, and rarely it might be a carcinogenic. So in our series, we have patients of we have 3 patients who had already had steroid-induced glaucoma. This is a 15-year-old boy with ocular allergic symptoms for 4 years. He had already undergone bilateral trabeculectomy, and still he was having this giant papillae. We can see he has glaucoma, the depressed field, visual fields, and he was already on tablet montelukast, steroid, and topical eye drops like anti-allergic cyclosporine, betamethasone, and carboxymethyl cellulose. And in left eye, we can see he has developed shield ulcer. So being a refractory case, we have started him on tablet azathioprine 50 mg, and oral and topical steroids were tapered gradually. And after 3 months, we can see his allergic symptoms were quite resolved, and the eye was totally quiet. He didn't have any congestion. This is another case, 14-year-old boy with bilateral advanced glaucoma, underwent right eye cyclophotocoagulation, and left eye was already operated for trabeculectomy, and he was already on anti-glaucoma medications, and his symptoms were not controlled with antihistaminics and topical tacrolimus, and he was considered for systemic immunosuppression, and also azathioprine was added in this patient, and oral steroid was tapered over 6 weeks. Another case of 13-year-old boy who had severe VKC with advanced glaucoma. He was already on antihistaminics, topical tacrolimus. He was initially started on oral cyclosporine, but despite his symptoms were persistent, azathioprine was added, and he was maintained after 6 months. So in our series, we had the mean age of presentation was 14 plus minus 2 years. Follow-up duration was 14 plus minus 4 months, and we had seen improvement in subjective symptoms and sign, and reduced congestion and corneal epithelial damage. No severe adverse effects were reported. 2 patients had mild gastrointestinal discomfort, for which the dose was reduced and were better. So azathioprine can be considered as a immunosuppressant in recalcitrant cases, but it should be a multi-speciality approach, and other workups like CBC, LFT, RFT, urine routine microscopy, MAN2, chest X-ray, triple H, serum IG, skin patch test should be done. So it can be considered as effective as other immunomodulators, and can be administered in conjunction with general physician or immunologist. And we should consider the risk versus benefit. In our case series, like almost all patients were blind in one eye, and we need to always monitor CBC, LFT, and RFT of such patients, and systemic side effects should be monitored. Thank you.
So good presentation. So the question is, how long this tablet to be continued?
This in this patient, the patient are usually in the teens, 14, 15 years. So it should be considered till they reach adulthood, or at least 1 to 2 years, and then slowly tapered off and then stopped.
Yeah, so the slowly tapering, you are already giving only once daily.
We are actually the dose we are giving is quite less. The recommended dose for azathioprine is around 3 to 5 mg per kg per day. So we are giving just 50 mg in
Yes.
these patients. So we are maintaining this patient. They are on like some patients are already taking it for 1 year, and once they are quiet and they are not having these symptoms recurrently, so we can stop it.
Okay. Thank you.